Hello, my name is Ashley Rosko. I'm an associate professor at the Division of Hematology at The Ohio State University. Today, I'm excited to share with you my abstract that was presented at ASH 2022, focusing on multiple myeloma transplant, examining the intersection of access, age, and race. So this PowerPoint presentation is in relationship to a study called Moving Mountains. The Moving Mountains study is a study evaluating accessibility to stem cell transplant for patients diagnosed with multiple myeloma in the community. This is the first of two parts. This is the first part of the presentation in which we are examining factors influenced by transplants such as race, age, socioeconomic status, and geographic location. And also understanding the degree to which these factors influence the ability to receive a stem cell transplant for multiple myeloma. The second part of the Moving Mountains protocol is forthcoming, in which we talk about an intervention in terms of a virtual healthcare delivery to improve accessibility to transplant for vulnerable patient populations. So in this study, what I'm presenting here today is patients, 1,799 patients, in which patients who were consented to the OSU registry, as well as patients who received a transplant from 1992 to 2020. So, over 30 years worth of data looking at type of patients and factors related to their transplant accessibility. In this study, the median age was 61 years of age. Race was self-identified as white 85.6% of the time, Black 13.1% of the time, and other is 1.3% of the time. This is very reflective of the race of patients that are seen here at Ohio State. In a multivariable analysis, patients who were older were less likely to undergo a transplant. When assessed by race relative to white patients, Black patients were less likely to receive a transplant. And when we analyze rurality based upon RUCA coding, which is a way to be able to analyze patients by a metropolitan and non-metropolitan using zip code, there was no significant difference in receiving a transplant based upon metropolitan versus non-metropolitan groupings. And then we also looked at socioeconomic status using something called the Yost Index. The Yost Index is a composite of education, income, and occupation variables. And patients that were residing in a higher socioeconomic status were more likely to receive a transplant compared to patients in a lower economic status. So in looking at this data, what we were able to identify is that we wanted to get a better sense of also where these patients were coming from and where myeloma is being seen by county level within the state of Ohio. So we looked at myeloma incidence by county level, and we looked at myeloma mortality by county level as indicated in the maps here. The reason for doing this is in part for part two of our Moving Mountains studies, in which we are looking to identify community oncology sites within these counters to be able to better serve these communities for patients with multiple myeloma. So in terms of our secondary part of our analysis, we wanted to look at survival from the time patients were diagnosed. Among all myeloma patients, the median overall survival was 9 years, and it was lower for patients as they aged. When we look at multivariable analysis, for patients who received a transplant, their survival was better compared to patients who did not receive a transplant. When we looked at survivability by race, we identified that patients that were self-identified as Black had an improved survival relative to patients who were self-identified as white. And then also patients that were living in a higher socioeconomic area by using the Yost Index also had a higher, more favorable survival. So in summary, when we looked at this study, we wanted to characterize additional factors of age, race, rurality, and Yost Index to be able to understand the receipt of transplant and survival for our patient population. And our next step for our study is an ongoing study where we're looking at increasing access within our by a county level across the state of Ohio, and making transplant more accessible by using virtual access. And that data is forthcoming. So thank you so much for listening, and please contact me if there's any questions. you.